Hello and welcome. My name is Robert Groisman, and I'm an anesthesiologist and a pain management specialist. You may be wondering what a spinal leak is. A spinal leak is a hole in the dura, which is the lining around the spinal cord. This hole allows spinal fluid to leak out. This hole is not normally supposed to be there. The dura holds in the cerebrospinal fluid, or CSF for short, and is primarily produced by the choroid plexus in your brain. Your body makes between 400 to 600 milliliters per day, which is about 1 3/4 cups to 2.5 cups of fluid. This is enough to replace the CSF 3 to 4 times a day. CSF does 3 C's. It cleans, it cools, and it cushions. The CSF circulates around your brain and down the full length of your spinal cord. Everybody's body is different, and that includes your rate of production and absorption of spinal fluid. As your body continues to absorb old spinal fluid that's now waste, and to produce clean new spinal fluid to keep your system healthy. CSF acts as a sort of hydraulic system to provide buoyancy and cushioning for your brain. Due to buoyancy, a brain that is supported and cushioned goes from a brain's normal weight of 1,500 grams to only 50 grams. That's 3.3 pounds to only 1/11th of a pound. That is why so many people with spinal leaks feel like they have a heavy head or a heavy brain. With a hole in the dura surrounding the spinal cord, CSF starts escaping and not staying within this hydraulic system. With smaller leaks, your body may be able to compensate in various ways to keep you mobile and experiencing minimal symptoms. This can cause issues at times if such a small leak is affecting your quality of life, but the symptoms are so subtle and appear different than expected that they do not match what many doctors are taught about spinal leaks in medical school. In one case, covered in research, a patient had radiating nerve pain in her lower torso on only one side. This back pain became worse the longer she was upright. After the patient had imaging done, the physician saw that she had a spinal leak. In this case, the patient did not have a headache, and the authors explained that small leaks can sometimes not produce a headache, but can cause other issues. The study authors hypothesized that spinal fluid in the epidural area can irritate nerve roots and can cause a great deal of back pain. In another study, following women at 18 months after an accidental dural puncture during a labor epidural, back pain was the second most common reported type of pain after head pain, despite the fact that the medical advice after an accidental dural puncture is that the symptoms should resolve around 7 to 10 days after. Studies like this one show that the majority of women with dural punctures can continue to have persistent pain. In this study, at 18 months after a puncture, 58.4% still had persistent head pain and 48.3% still had persistent back pain. Pain is important in a spinal leak case, especially as physicians have noted that local back pain can be present at the site of the leak. This pain can help physicians better locate the leak from symptoms alone. Note that a leak site is still causing problems and also lead to a correct diagnosis of a spinal leak, as post-dural puncture headaches, or PDPH, may not seem appropriate in your case. If it is your back that is giving you so much pain, months or years after the puncture. Pain is just a clue. Even if you have only back pain and no head pain, you will often have noticed that something just doesn't seem quite right beyond the pain. In my next video, we will go into more detail on how spinal leak is a structural issue and how the lack of necessary CSF volume can create various neurologic symptoms, from feeling disconnected from this world to autonomic dysfunction. Make sure to like and follow this account and as I create more educational content to guide people in explaining root causes and developing plans designed to improve patient quality of life. This is Dr. Groisman signing off.